Thank you for visiting the Pet Resource Center of Kansas City. Now that your pet has had surgery, we want them to have a smooth recovery, so please watch this from beginning to end. Your pet has just undergone major surgery. Please follow these instructions to reduce the risk of complications. Your pet may be hungry when you get home. Please offer a small meal when you get there, typically about a quarter to one-half of what you normally feed them. A small amount of water is okay too. Sometimes vomiting can occur after a pet receives anesthesia. If that happens, withhold food until the following morning. Water is okay, but in small amounts. If your pet holds down the first small meal, feel free to continue offering small meals throughout the evening. Just stick with your pet's normal food and avoid rich foods and table scraps for the next 2 weeks. It is especially important for young or small animals to eat the night after their surgery since they don't maintain their blood sugar as well as larger animals. Although your pet can begin eating small meals right away after surgery, their activities must be restricted for 10 to 14 days. This is very important. For cats, that means a limit on running and jumping. They should also remain indoors the entire time. For dogs, they should be kept in a clean space, prevented from running or jumping, interacting with other pets, and be kept on a leash when they go outside for bathroom breaks. These activity restrictions are important to reduce the risk of complications. You can utilize a kennel for your pet when unsupervised to limit activity. If you're still finding it hard to keep your pet calm, we may be able to prescribe a sedative that can help. Too much activity can cause swelling, increased risk of bleeding, and open your pet's incision. It's also important to keep your pet separate from unaltered pets of the opposite sex for 2 weeks after surgery. During the recovery period, please keep your pet's e-collar on so they don't lick or chew the incision site. You do not need to clean or apply ointment to your pet's incision unless otherwise instructed. However, if the incision gets dirty, clean it gently with warm water and then gently dab it dry. The sutures we used are under the skin, so you shouldn't see them. Surgical glue is placed over your pet's incision and tattoo. This may look funny as it naturally flakes off over the next few weeks. In addition, the tattoo ink can get messy and smear during the application. With time, this will come off too. Your pet received 2 injections of pain medication during surgery. If your pet still seems to be in pain when you get home, please call us. We also included post-operative pain medicine in your go-home packet. Please use it exactly as directed. And make sure to never use human medications such as aspirin, Tylenol, ibuprofen, or any other human medicines. They can be deadly. Because of anesthesia, your pet may be sluggish, whiny, or anxious the night after surgery. During the healing process, here are some normal symptoms you may see with your pet. Small spots of blood, reduced appetite for up to 48 hours, small amount of vomiting for 24 hours, closed incision with surgical glue on top, mild redness and swelling under the incision, and your pet may not defecate for 48 hours. Some abnormal symptoms include unresponsiveness, continual bleeding or seepage, a complete refusal to eat or drink the next day, an open incision or a protrusion from the incision, discharge or uncomfortable redness of the skin, an inability to urinate, or large, soft swelling at the incision site. If you're concerned about your pet, please contact us immediately. There is no charge for a follow-up within 14 days of your pet's surgery. You can also send a text to the number on the screen. But if it's urgent, please contact an emergency clinic right away. Any costs associated with emergency treatment will need to be covered by you. As always, thank you for giving us an opportunity to care for your pet. If you have questions or need anything, please get in touch.